My name is Dr. Rick Seguil.
And action. Hey, Jay, this is Kirk, man.
Hey everyone, it's Dr. Rick. I'm going to continue with the series Exercise and Diet, and this time we're going to be talking about a prequel. We really should be checking your blood pressures before you start to exercise, because even if you do exercise, even if you don't have any medical problems or you don't feel anything, if I was to check you in the office and we found elevated blood pressures, then it would be a little bit dangerous to tell you to go push more weight or to go run more distances or to sprint uphill, although it's for a good cause, meaning exercise. Your blood pressure is already high and we push it even higher. But inevitably, you're going to have to push your heart and your cardiovascular system to the brink of exhaustion. So if you're starting off with an elevated BP, as the standards set by the JNC8 or the ACC-AHA, we have a little bit of danger. Now, in the end, exercise is supposed to lower your blood pressure, especially more cardiovascular than resistance exercise. But I think any form of exercise can be manipulated properly to kill maybe two birds with one stone. Not kill you, but kill two birds with one stone, meaning take care of your blood pressure, also build up muscle, and maybe three birds with one stone. Take care of your metabolism and raise it. Remember, muscle, when it's built up in tone, acts as a place where you can dispose of glucose and cholesterol with good cardiovascular tone, which is the blood vessel tone, the muscular walls of the blood vessels. Well, they get exercise too. Just like when you're exercising and you're ready for a 5K. Your muscles are loose. They're ready to take on the challenge. They're not sore after you compete. Well, if your blood vessels are also worked and they know how to expand, contract, then actually at rest, your blood vessel tone will be lower than usual, meaning cardiovascular resistance will be lower, your blood pressure will be lower, and you'll have less risk for damage later on. There are a couple of my guys who come in with white coat hypertension, and anytime we put one of these cuffs on, it automatically constricts, and you can hear that tightening, and you hear the Velcro, and you hear the machine, and it's nothing worse than when the machine, especially if you have big arms, not that I have big arms, but I usually need a larger cuff. But when the machine tightens up, on my arm in particular, it decides after a couple seconds, I'm going to tighten even more. It's like, oh no. Because I inevitably will think that the blood pressure is going to be high. But bottom line is that exercise will bring it down. So I'd like you to start exercising. If you're on your own and you don't have me as a doctor, ask your doctor if your blood pressure is good, if it's healthy, and if your target is where you're supposed to be. If you're not, then get some suggestions from your doctor about how to lower conservatively at first. It should always be lifestyle change first. And there is something called the DASH diet. I'll put a link somewhere here to what the government puts out as far as the DASH diet. I would print it up in color if I were you, because the pictures are pretty cool. It is a little bit on the dry side, and it's I think 20 pages the last I checked. But it does give you more than just a diet. It gives you ideas about activities, tells you about sleep, tells you about reducing alcohol, anticipating stress by having some form of mindful practice. And I always talk about those four things: taking care of nutrition, not being sedentary and being active, having maximized sleep efficiency and a restored feeling when you wake up, in addition to some form of stress busting, meaning don't wait for the stress to occur and then deploy your stress busting activity, but do the stress busting activity every day, twice a day. I have my old go-to 4-7-8 breath exercise. It's secular and it does work to link mind and body with your breath. It's entry level, but it is a start. If you have the opportunity to see a psychotherapist for teaching, maybe some cognitive behavioral therapies, I think I'd do it, especially if you do have white coat syndrome. The white coat syndrome is when a person's blood pressure shoots up very high, higher than normal, which is higher than 120/80. The idea would be if it comes back down outside the office for 7 days, 2 readings a day, then you're safe. Sometimes we can negate what you find in the office by giving us the 7 days. And sometimes there's also a 24-hour blood pressure cuff monitor that you can wear. Some insurances pay for that. Bottom line is that if you have a pretty decent machine, if you go to the Jewel Osco or the Walgreens or Meijer in Illinois and you put your arm in the cuff, press the button, and you get a reading, write it down. And you keep on going to that one place if you cannot afford a blood pressure cuff. I think that now that COVID's kind of over, you think you can actually visit some of the fire stations and get some of the young guys to check your blood pressure. And I hear they're kind of good looking. So if you're looking for a mate, make friends with your local fire department. And they might be saving your life, so I would bring them something as well, something healthy. There are conservative things that you can do to help lower your blood pressure. There are some supplements that you can take, and I'll put lists here about which supplements I have found and I've done videos on. I'll put the links in the comment section down below. Check them out. I think that they are helpful, not only for fixing deficiency if it's found, but also for helping lower that blood pressure. Even if you and your doctor have come up with white coat syndrome, where you're a little bit afraid when you go to the office, if that blood pressure spikes into the 180s, that's a problem. That's the systolic, the top number. Or if your diastolic spikes into the 120s, that's a problem too. Even if you don't have any symptoms and those two numbers go to 180 over 120, inevitably that's going to give you a problem. And if you have hypertension just by walking into an office and seeing a doctor with a stethoscope, what more will you have when you get into a car accident, when you wake up and the house is on fire, when you have to run from danger? All those things will turn on your sympathetic system. And if your blood pressure is already high and your sympathetic system gets your blood pressure even higher, you will stroke out. It's important that even if it's white coat, even if it's medical anxiety, you might have to bring that down with medicines. We try conservative measures first, we try supplementation second, and sometimes we have to use medicines, even a microdose of medicines. Then there are several different classes that you can use that if you search online, you're going to see every family of medicines for blood pressure has a side effect. So don't read into the side effects. See what your doctor might be planning for you, or have involvement in the decision-making process for what you will be deploying as per the doctor's knowledge base. And that's where the JNC8 and the ACC-AHA has come up with guidelines for doctors to deploy certain medicines. There are certain medicine families that are better for African Americans, better for Asians, better for obese people. So there is a plethora of different things that you can use, and hopefully if you do keep on pushing at that lifestyle change, you will be able to lose weight, since 50% of America is overweight, which leads to high blood pressure, and maybe in time get off your blood pressure medicine with successful lifestyle change. Whether that lifestyle change is loss of weight, or lowering the sodium, or cutting out alcohol, or cutting out caffeine, or maybe even getting off one of your medicines. Remember, certain medicines, no matter what they're for, will have side effects of high blood pressure, weight gain, and interrupting your sleep, which all lead downstream to high blood pressure. That doesn't mean you're supposed to stop your medicines on your own. It just means that you have to work with your provider on finding the best template for you. Everybody has a list of ingredients that works for them for the best recipe, which is healthy life. But not everybody's recipe looks the same. And that's why I think it comes down to personalized medicine. This is what I do with integrative medicine, and I am available to do consults even outside the state of Illinois or outside the US. Please consider not only subscribing to my YouTube channel, but consulting me on my Herbal 411 page. Bottom line is exercise and diet will always be the things that you can deploy on your own, but if you do have a little bit of an elevated blood pressure, take care of that first. Hopefully, we'll all get old together without any complications. Don't forget to share this video with other people that are having white coat or high blood pressure, and give it a thumbs up if it helped you. Hit the alert bell to find out when I do new videos, otherwise I'll see you at the next one.